This is a patient who had a small 1.5 centimeter tumor in the right breast. She was an ideal case for breast conservation surgery and highly motivated to preserve her breast. You can see the mammograms, which shows the microcalcifications and the BI-RADS 5 rating, which is highly suspicious for malignancy. We did a breast conservation surgery on her. Through the lower incision, the main primary tumor was removed, and through the axillary incision, which is about 1.5 to 2 centimeters, we removed the sentinel lymph nodes. Shefali Agrawal, professor and senior consultant in surgical oncology. I trained at Johns Hopkins University School of Medicine in the US and in New York, where I specialized in gastrointestinal cancers and breast cancers. Here in India, we are specializing and have built a state-of-the-art program in breast conservation surgery for breast cancer, which helps women avoid the dreaded operation of a total mastectomy or complete removal of the breast. The current standard of care worldwide in the treatment and diagnosis of breast cancer, with a particular focus on what would be the best treatment of choice surgically for breast cancer, particularly cancer which is diagnosed in the early stages. Every month is Breast Cancer Awareness Month. We don't believe that only the month of October should be dedicated to breast cancer awareness. Breast cancer awareness saves lives, and every month and every day should be dedicated to breast cancer awareness. As we are aware, the most common cancer in women is breast cancer. It is the leading cause of cancer-related death in women. And half of all breast cancer cases diagnosed in underdeveloped countries have a 58% mortality, which is an unacceptably high level of mortality because women are diagnosed late in the later stages of breast cancer, which makes treatment much more difficult. Lack of awareness and delayed diagnosis contributes to these poor outcomes, whereas in the Western developed nations, because of the extensive and routine use of mammography, they have excellent survival outcomes with breast cancer, particularly early breast cancer, which has survival in excess of 95%. In breast cancer survival, the stage of breast cancer at diagnosis is the key determinant of survival. As we can see, for early stage breast cancer, the survival is in excess of 90%. And once the cancer has spread to lymph nodes, which is stage 3, the survival falls to 50%. And even in the later stages, stage 4, it falls further to 20%. This emphasizes the need for early diagnosis and awareness, of which the most important step is the routine use of mammography in women over the age of 40. What are the risk factors for breast cancer? We are aware of most of these factors. The important ones are a family history, because that suggests a genetic predisposition, presence of genetic mutations such as BRCA1, BRCA2, presence of atypical hyperplasia on any breast biopsy, increased or high breast density on mammography, use of exogenous hormones, particularly estrogen, is our more newly identified factors which suggest increased risk for breast cancer. This is a National Cancer Institute breast cancer risk assessment tool, which is available online to all doctors. You can Google this and you'll be able to find it. You can put in the information of the particular patient, the demographic information, and you'll be able to get an accurate idea of what the risk of that woman is. Is it the routine average risk, or is it an elevated risk of breast cancer? The most common sign, the most common symptom of breast cancer is a lump in the breast. In addition, there are other important signs which a woman should be aware of. They include change in size or contour of the breast, nipple discharge, particularly if it is bloody, unilateral, and spontaneous. Skin changes such as irritation, puckering, and dimpling, particularly in the nipple areolar region. Warm, red, swollen breasts, or pain in a particular fixed spot of the breast which persists beyond 2 to 3 weeks should be evaluated by a breast cancer surgeon. For the early detection of breast cancer, because as we discussed, The stage at diagnosis of the breast cancer is the most important determinant of survival. Mammogram is the only recommended modality for breast cancer screening. If this is combined with ultrasound, the sensitivity and the accuracy goes up even further, but mammogram is the only accepted modality. Measures such as self-breast examination and clinical breast examination by a doctor are helpful, but they do not improve survival, and they are unacceptable as screening modalities. Self-breast examination, the technique can be learned on YouTube. There are several 1.5 minute videos, which every woman above the age of 18 should take a look at. And all women starting from the age of 18 should be doing a self-breast examination once a month, 5 days after their period. What is a mammogram? Mammogram is a very low dose X-ray that detects changes in breast tissue well before any symptoms or lumps are felt by the patient. So it helps with very early diagnosis or subclinical diagnosis of the cancer, which is why these patients are diagnosed at a very early stage 1, and early stage breast cancers, as we noted, have a survival in excess of 95%. Mammogram is the only acceptable method of breast cancer screening, and every woman above the age of 40 should undergo a routine mammogram every year until later in life. There is no upper limit defined. So every woman above the age, starting at the age of 40, should undergo a mammogram every year at a good institution with good radiologists. For if a poor quality mammogram is done, or if the radiologist is not experienced, the purpose of the mammogram will be lost. It is the only acceptable screening method for breast cancer, and it results in a 25% reduction in mortality versus women who do not undergo routine breast mammograms. These are the NCCN or the National Comprehensive Cancer Network guidelines, which reiterate that breast cancer screening should begin at the age of 40. These are just a few cases to reiterate the importance of early diagnosis. This was a 33-year-old pregnant female with a self-detected 2 by 2 centimeter lump felt in the left breast. It was gradually increasing in size. We operated her, did a wide local excision. The core biopsy had suggested to us that it's a cystosarcoma phylloides. Very important that this is taken out with widely negative margins on pathology. Otherwise, the propensity for recurrence is very high with this tumor. As you can see, it was taken out with a generous margin of normal breast tissue, and she had an excellent cosmetic outcome. She was discharged home the same evening, and she's now about 7 years out from surgery, doing well without any recurrence. What are the standard investigations for breast cancer or a woman who feels a breast lump? The most important 2 tests are a high-quality mammogram and ultrasound. The rest of the tests, we are all aware of them as physicians, MRI and pathology and image-guided core biopsy. But the 90% of the tenet and the fundamental for breast tumor diagnosis rests on mammogram and ultrasound. There are 2 main operations that we are aware of for breast cancer. One is a total mastectomy with complete axillary lymph node dissection. This is the traditional operation which was done. It's called a radical mastectomy. And the more recent one is breast conservation surgery, where we are able to avoid complete removal of the breast. And that involves wide local excision of the breast tumor with a generous margin of normal breast tissue and sentinel lymph node dissection to avoid the side effects of a complete axillary lymph node dissection. As we can see in the images here, this is on the left is a woman who underwent complete axillary lymph node dissection, and she has developed lymphedema of the arm. This causes significant morbidity to the woman and impairs the quality of life. These are the advantages of breast conservation surgery, where you do not need a mastectomy. Simply the main tumor is removed with a margin of normal breast tissue, and the entire lymph node dissection is not required. This is the incision through which the sentinel lymph nodes, which is 1 or 2 lymph nodes, which are the main lymph nodes where the tumor drains, are sampled and sent for pathology to ensure that the remaining lymph nodes are also tumor negative. As you can see, the quality of life is superior with the breast conservation surgery. The recovery time is much shorter and the cosmetic outcome is excellent as compared to a mastectomy incision where the complete breast is removed. As far as the survival goes, it's very important to know that the oncologic survival or the long-term survival, whether you do a total mastectomy or you do breast conservation surgery, are identical. There is no difference in cancer-specific mortality, whether you do a total mastectomy, a radical mastectomy versus breast conservation surgery. Both methods are equivalent in terms of survival and patient outcomes. This is the standard radical mastectomy. The patient has had multicentric breast cancer, where you can see that there are multiple foci in the breast. She was not a candidate for breast conservation surgery. We've done a total mastectomy and avoided a complete axillary lymph node dissection. We did a sentinel lymph node dissection and her lymph node was negative. So she underwent a total mastectomy with sentinel lymph node dissection and required a prosthesis subsequently. This is a patient who had a small 1.5 centimeter tumor in the right breast. She was an ideal case for breast conservation surgery and highly motivated to preserve her breast. You can see the mammograms, which shows the microcalcifications and the BI-RADS 5 rating, which is highly suspicious for malignancy. We did a breast conservation surgery on her. Through the lower incision, the main primary tumor was removed, and through the axillary incision, which is about 1.5 to 2 centimeters, we removed the sentinel lymph nodes. She had an excellent cosmetic outcome with preservation of the breast contour. Her pathology report was demonstrated no lymph node metastases. She received adjuvant radiation therapy and hormonal therapy because she was ERPR positive. She's now about 6 to 7 years out from surgery, completely cancer-free, with an excellent quality of life. It is now widely recognized and accepted that breast conservation therapy is the treatment of choice in early stage breast cancer for several reasons. It gives a superior quality of life, including quality adjusted life years. The mastectomy followed by immediate reconstruction or delayed reconstruction, particularly using autologous tissue, has a high risk of complications and with large and long-lasting negative impact on quality of life. Breast conservation therapy is associated with fewer complications, superior quality of life, and cost effectiveness compared to mastectomy with breast reconstructions. Breast conservation surgery is the treatment of choice for early breast cancer. This is the most important lesson from our talk today. So in conclusion, all women should have annual mammograms starting at the age of 40. Breast conservation and surgery and mastectomy have identical survival. Breast conservation surgery offers superior quality of life, cosmesis, and faster recovery. Even patients with large tumors should be considered for breast conservation of surgery with preoperative chemotherapy, which helps us shrink the tumor and make the patient amenable to breast conservation surgery. All patients diagnosed with breast cancer should be considered for breast conservation therapy. These are breast cancer screening camps that we have held in the very remote areas of Chhattisgarh. These camps were held with the help of ASHA and A&M and Anganwadi workers. There was tremendous enthusiasm, and all these women from the villages and from the tribal areas have come forward to learn the technique of self-breast examination, as well as to undergo clinical breast examination with the doctors in the camp. And then women over 40 were selected to undergo mammography at the Raipur Medical College, which has increased tremendously the awareness about breast cancer information and screening throughout the region in Chhattisgarh. These were tremendously successful camps, and it was most heartwarming to see the so-called the underserved part of India and of Chhattisgarh, where the women have so enthusiastically come forward to be examined and evaluated for early detection of breast cancer. This is Raipur Medical College, where the breast conservation surgery and the breast cancer surgery is performed, and for all the women who were diagnosed and detected during these breast cancer screening camps. All this information is available on our website, gibreastcancer.com. Please feel free to visit the website and read the information in greater detail. And I would like to reiterate that every month is Breast Cancer Awareness Month. Please encourage women to come forward, undergo mammograms, and take the fear of the dreaded operation of mastectomy out of their minds. Most women are candidates for breast conservation surgery, and they have excellent recovery. They go home the same day or the following day. There are no drains placed, and the cosmetic and quality of life outcomes are excellent. Thank you.